prolactin hormone increases, what are the various treatment options available to reduce this hormone? Do you also know why does a doctor wants to treat your high prolactin level? If you don't know, and if you want to know the answers of these questions, stay tuned with me in this video. I'm going to discuss about the various reasons why prolactin hormone has to be treated and what are the treatment modalities. Namaste, I'm Dr. Tanvi Mayur Patel, endocrinologist, hormone specialist doctor from Mumbai, India. अगर आपको इस वीडियो को हिंदी में देखना है तो ऊपर एक आई बटन पे एक लिंक है, आप उस पर क्लिक कीजिए. If you want to watch this video in Hindi language, on the I button there is a link. You can click on that link and you will see this entire video in Hindi language. So let's continue today's topic. So by the way, this is our 5th video on the series of the prolactin hormone. If you have not watched any of those videos, I'll request you to visit that video and please watch that video so that you will have a detailed knowledge about this topic. In the first video, I spoke about what is a prolactin hormone. In the second video, I discussed what special precautions you need to take before undergoing any blood test for your prolactin hormone testing. In the third video, we discussed about what are the symptoms when your prolactin hormone increases. And the fourth video, we spoke about what are the reasons which causes the high prolactin level. Let's continue this series of the video, and today's 5th video, we are going to talk about what are the treatment options. So first of all, the moment we prescribe that medication or the treatment for the prolactin hormone, the very first question a patient asks, Doctor, do I need to treat this high prolactin level? Well, answer is yes. The reason being prolactin hormone has a various other effect on your body. So when your prolactin hormone increases, it has an impact on your fertility, it has an impact on your bones and many other things. So it is very important for you to treat your high prolactin level. Now, so whenever a doctor advises you the treatment for the high prolactin level, what is the reason behind this treatment and why do you need to treat this high prolactin level? Well, the reason can be plenty many. First, let's discuss why we need to treat it. The first reason, we want to make sure that your prolactin hormone remains in the normal range. Now, what is a normal range? I've discussed about that in the first video. Here on a grossly, I'm just telling you the normal prolactin hormone range varies from 5 to 20 nanogram per milliliter. So your doctor wants to make sure that your prolactin hormone remains in this range. The second reason, when you have a high prolactin level, especially in a woman, it makes their periods, menstrual cycle irregular. So we want to regularize this. That's why also we want to treat the high prolactin level. High prolactin level has a direct impact on your fertility. So we have observed that the patient who have a high prolactin level, it becomes very difficult for them to conceive. And by any chance, if they conceive, they've got a very high incidence of miscarriages. So we don't want you to go into this infertility and repetitive miscarriages. That's why also we want to treat this high prolactin level. When a prolactin hormone increases in men, what does it cause? It causes the decrease in the sexual drive, decrease in the libido. It reduces the quantity of the semen. There is a sperm quality which gets affected, and also it has an impact on your fertility. So we don't want you to land up in an infertility and land up with all the infertility treatments like IUI, IVF, ICSI, test tube babies. So to prevent you from going into that infertility zone, we want to make sure that the prolactin hormone remains normal. Also, by any chance, if you are undergoing any infertility treatment, at that time also prolactin hormone has to be regular so that you do not land up into a repetitive miscarriages. Now, when your prolactin hormone increases, this has an impact on your bones. The bones which are very strong and resistant to fractures becomes very weak and fragile. So any simple tension can cause a fracture. So we don't want that to happen. So that's also one of the reasons for the treatment of your high prolactin, that we don't want you to land up in a complication of osteoporosis. Now, when your prolactin hormone increases, it has an impact on your immunity also. When a prolactin hormone increases, what it causes a disturbance in the function of a gonads, that is a testes in a man and an ovary in a woman, and their function gets disturbed. So we don't want that to happen. Again, that's why your high prolactin has to be treated. The prolactin hormone comes from a very small pea-shaped gland called as a pituitary gland, which is located in your brain. So when a prolactin hormone gets disturbed, this functioning of the pituitary gland and along with that hypothalamus, another gland, both of their function gets disturbed. So we want those glands to function correctly so that your entire hormone of your body remains in the normal range. For that also, correcting this high prolactin level is very, very important. Many a times this prolactin hormone increases because of a small tumor in your pituitary gland. So we don't want that tumor to grow, and we want to control the size of the tumor. For that also, high prolactin level has to be treated. When you have a tumor, many times it causes the disturbance in your vision. So we don't want you to have those complications of the visual disturbance. That's why also we need to treat this high prolactin level. So now you know, whenever you have a high prolactin level and a doctor advises your treatment, you know what are the reasons why a doctor wants you to treat your high prolactin level, and if you don't treat it, what all complications can happen. So now let's go to the main topic. What are the various treatment options available? Now, the first and a very important thing before we start to a treatment is we need to know, why is your prolactin level increased? Yes, it's very simple. If we know the reason why it is increased, it makes very easy for a doctor to treat that cause. Many times when you have an uncontrolled thyroid problem, thyroid is, by the way, a gland in your neck. So if you have uncontrolled thyroid function, prolactin tends to be high. When you have a PCOS or a PCOD, that is a polycystic ovarian syndrome and polycystic ovarian disease, by the way, they are one and the same. When you have this PCOS or PCOD problem in a woman, again prolactin tends to be disturbed. Many a times a person is taking medications for various other reasons, like a blood pressure tablets, depression medications, then the antipsychotic drugs for their mental diseases, and a very commonly used over-the-counter drug like acidative pills. These all medications can also disturb your prolactin hormone. Many times women is taking oral contraceptive pills which contains an estrogen in it, that can also cause a disturbance in your prolactin hormone. So it is important for a doctor to know that why your prolactin is high. Many times your prolactin can be disturbed if you have any liver problem or a kidney problem. So if your prolactin level is high, of course the doctor will try to see whether you don't have an issue in those organs. So now once we know this, now we know it is easy to treat. Now what are the treatment options available? Basically there are three main type of a treatment options. One is a medications, second is a radiotherapy or a radiation therapy, and a third is a surgery or an operation. Based on your case to case, a doctor will decide which kind of a therapy will be right for you. So let's discuss the very first option, and that is a medication therapy. Now, this medication therapy is a very, very effective. This is usually a primary treatment. The very first doctor will give you this option. Unless and until it is a contraindicated or it is your case is out of the complication zone. Now, so this medication therapy, they are primary therapy, and in this medication therapy, we mainly use the two drugs. One is the Cabergoline and second is the bromocriptine. Now, if we talk about the medical language, then both of these drugs fall in the category of dopaminergic agonist. What do? They reduces the secretion of the prolactin hormone from your pituitary gland. So they both are a prolactin inhibitor drugs. Well, I am not talking too much about these drugs in this particular video, but I have made a special video where I will be discussing in depth about the Cabergoline drug. Okay, when to take, why you need to take, what dose to be taken, whom to be not to taken, all those details I have mentioned in that video. You can watch that video after this. All right, so now that is the medication therapy. Medication therapy is a very safe, very effective, and it is a not very expensive. It's a very cheap therapy comparatively. Now, medication therapy, as I told you, it is very effective. Nearly 80 to 90% of the patient respond to this therapy, and only when they don't respond to this therapy, many times we want to go to the other level of the therapy. Now, this medication therapy, they are very effective. Many times this therapy starts showing its effect within few weeks. Only disadvantage with this therapy is that many a times a person might need to take this medications for a lifelong. But again, that depends on your case. Your doctor will be the right one to guide you as per your medical case. Right? So this is about the very first option, that's a medication therapy. Now let's move on to the second mode of the treatment, and that is a radiation therapy, also called as a radiotherapy. Now, radiotherapy is applicable only to those patients who have a tumor in their pituitary gland. If you don't have a tumor, then this therapy does not meant for you. Now, radiation therapy, what do we do in this? In this therapy, we give a very high dose of a X-ray, and this high dose of the X-ray destroys this tumor, and that is how this therapy works. This therapy is applicable to those patients who are neither a candidate for surgery or they are not a candidate for a medication therapy, or medication therapy is failing in such cases. So in those cases we advise the radiation therapy. Many times radiation therapy is used along with the surgery also, based on again a case. Alright, so that was the second mode of treatment. The third mode of treatment is the operation or surgery. Again, like radiotherapy, this therapy is also applicable to only those patients who have a tumor. If you don't have a tumor, again this therapy is not meant for you. Now, who does this surgery? Well, this surgery is either performed by a skilled ENT surgeon, that is your ears, nose and throat doctor, or it is also done by a neurosurgeon who are experienced in the neurosurgeries. This treatment is called as a transsphenoidal surgery. This surgery is usually done through a nasal aperture. Okay. Now, in detail, I am not going about that surgery right now. So this is a third option, that's a surgery. Now, who are the candidate for the surgery? Those people who they do not want to take a medication. Yes, there are plenty many patients who refuses to take the tablets. They want to go direct with the surgery. So those cases. Secondly, some individual is taking the tablets, but they are not able to tolerate this drug due to its side effect. Again, and the tumor is large, of course we advise the surgery. Or many times the medication is not a right drug for you, or maybe you are a contraindicated for this drug. Sometimes the person is taking this drug, in spite of taking the drug regularly, they are not seeing any improvement, or rather their condition is worsening more and more. So such cases also we advise the surgery. Many times the tumor in the pituitary gland is very large, and such a large tumor cannot be controlled completely by the medication therapy. Then also surgery can be an option for you. Or many times this tumor is very large and that causes a disturbance in your vision. Now, why does that happen? Because this prolactin hormone comes from the pituitary gland, and where this gland is situated in your brain, just near there are two nerves from your eyes, what we call it as an optic nerve. So both the nerve crosses each other, and this crossing is called as an optic chiasma. So many times a large tumor compresses this optic chiasma, and that causes a visual disturbance. So if a visual disturbance is a lot, in that case also a doctor might advise you for the surgery. As I told you earlier, we always try for the medication therapy first. If that fails or that cannot be done for your particular case, then only we move on to the radiation therapy or a surgical therapy. So these are the main three modalities of the treatment of a high prolactin level. Again, the treatment is case to case. So please speak to your doctor. He will be able to guide you. If you have any questions, any comments, please write in the description box. I will try to answer all your questions as early as possible. And if you want to have an individual consultation with me, there is a number which is noted down here. That's on that number you can WhatsApp us and you can reach out to me personally for one-on-one consultation. Kindly note that this private consultation is a paid service. It is not a free service, right? Anything else if you want to know, please leave your comment box. And this is our video number 5 of the prolactin series. I'm still going to make a couple of more videos on this series, and we'll discuss more about the Cabergoline drug, how this drug affects your fertility, and many other points. All right, that's it for today. Thank you for joining me. Stay tuned and namaste.